Okay, so my name is Hans. This is my EJV OSCE. To begin things, I'm going to ask the patient for consent. If the patient is unconscious, I'm going to ask the trusted family member, do you give consent for this patient to receive an EJV?
I give consent.
Alright, fantastic. Okay, next up I'm going to position the patient's head to prepare for cannulation. Next up I'm going to distend the jugular vein, so either I can apply pressure on the liver to induce the hepatojugular reflux, I can elevate the patient, tilt the head backwards into the Trendelenburg position, or I can ask a nearby offsider or a family member, or even the patient themselves if they're conscious, to elevate their legs. Okay. Next up, I'm going to clean the site once the vein is distended. There you go. I'm going to keep the prep pad there in case the site gets dirty again. I'm going to prepare my cannula. First up by drug checking the saline, so yep, expires in July of 2026, and that is sodium chloride at 0.9%. Okay, just going to use about 2 millimeters as my saline block to prevent any air emboli. Going to clear the air, great. And then we're going to use a hypothetical 14 gauge, but this is a 20 gauge just so it's good for the dummies. Right, and try of everything else. Everything is all good. Okay, sharps out. Okay, now bevel up. I'm going to apply a little bit of pressure to tamponade the vein. I'm going to pull back on the skin. I'm going to apply the needle at a 15 to 20 degree angle. Right, advance. Okay, now I'm going to aspirate. Yep, we have flash. Flatten the bevel. Just advance 3 millimeters, and I'm going to push out the cannula. Okay, apply some pressure before we remove the needle. The needle's got a mind of its own. Into the sharp spin. Okay, I'm going to put some gauze beneath here just in case it bleeds and to wipe out any excessive blood. Fantastic. Okay, now we're going to flush. Yep, we have the patent line. I'm going to remove the syringe. I'm going to start securing the site. We have ensured that there's no risk of pneumothorax as we're high enough above the lung so that we won't penetrate it. We have ensured that there's no plastic emboli as we have a patent line and there is no catheter sharing. And we've ensured that there's no air emboli by checking the syringe beforehand. Okay, now we're going to position our tegaderm so that we have a window to the site if there's any complications. Come on. There we go. Okay. Secure the lure plug as well. And then we're going to write our date on this little piece of tape. And then making sure that we don't occlude the window. Ready.